There are usually two main advantages why people come to see me for having a rhinoplasty. It's either to improve the function of their breathing or to change the shape of their nose. Very often patients come in because their nose is deviated or bent to one side. They find that they have difficulty breathing through both sides of the nose. So by doing surgery, we could address the midline or the septum of the nose to improve the airways and therefore improve the breathing. And the other common reason why patients come to see me for rhinoplasty is because they've had an injury in the past and their nose is bent or twisted to one side, and they want to have a straighter nose. Or if they have a big hump, a bump on their nose, they want to correct it, or to get more definition to the tip of their nose. So the main disadvantage or the main issues to look at following a rhinoplasty is the swelling. So often we would normally tell a patient that the swelling may last up to about 12 to 18 months. The top third of the nose takes about 3 months to go away. The middle third takes another 3 months. And it's usually the tip, the swelling of the tip that takes longest to go away. And that probably takes can take up to 12 to 18 months. Other issues that can happen, sometimes the tip of the nose is a little bit numb, but the sensation will come back again with time. It usually takes about 6 months. Patients can sometimes have a little scar at the bottom of their nose, depending on the type of surgery that has been done, but that usually heals very well without any problems. And I think initially it's just about letting the swelling settle down first, and as patients will see how things improve with time. Rhinoplasties tend not to be painful. Often during surgery, we would put some local anesthetic as injections around the nose, and that would numb the nose itself. And the local anesthetic usually lasts between 4 to 6 hours. Very often, the main complaint that patients may have is that their nose feel a bit congested or blocked after the surgery, but that tends to improve after a couple of days. But it's usually not a painful operation. It depends on the type of rhinoplasty that one is having. If it may last between 1 hour to 3 hours, or sometimes a little bit longer, depending on the complexity of the surgery. On average, a rhinoplasty takes about 2 to 2.5 hours. But sometimes if it's a revision rhinoplasty where somebody has had a rhinoplasty before, where we have to go back in and then do more reconstruction, that might take a bit longer. But on average, it's about 2 to 2.5 hours. I think for a patient who's considering to have a rhinoplasty, first of all, you have to do a bit of background research. Firstly, you have to see, identify in yourself, why is it that you want to have a rhinoplasty? What are the main reasons behind it? I think it's important to read a bit about what rhinoplasty is and what are the benefits and what can be the risks of rhinoplasty. And I think it's also important to research your surgeon who's going to do the rhinoplasty. Rhinoplasty is a complex procedure that many surgeons do not like to undertake. And I think it's important to have a surgeon who does rhinoplasty regularly. I'll probably say one rhinoplasty a week, because that gives the surgeon the confidence and the expertise to be able to deal with most types of rhinoplasties that needs to be done.